If you watched the previous videos in this series, then you've learned how where a person lives, their socioeconomic status, their health behaviors and predispositions can all affect their access to and the outcomes of their healthcare. In this video, we're going to talk about health disparities in the context of a very specific example that has affected everyone in 2020, the COVID-19 pandemic. Before we get into it though, let's quickly define some terms that we've all heard, just to make sure we really understand what they mean. The virus we are all familiar with is the 7th coronavirus known to infect humans. It's called a coronavirus because of all the spikes that shoot off each individual particle. The Latin root corona means halo or crown. Prior to 2019, humans had never been exposed to this type of coronavirus before, and therefore it is sometimes called the novel or new coronavirus. Because it is totally new to us, our immune systems haven't had time to figure out how to deal with it, which is why it has had such devastating effects and has caused a pandemic, which is a term used for when a disease spreads across a large area, like a country, continent, or in this case, the entire world. The disease caused by the novel coronavirus is called COVID-19. The CO stands for corona, the VI stands for virus, and the D stands for disease. The 19 is in there because it was first transmitted to humans in 2019. And in case you're wondering why the official name of this virus is SARS-CoV-2, it's because it stands for Severe Acute Respiratory Syndrome Coronavirus 2, which is a fancy way of saying it causes trouble with breathing. When humans talk and breathe, we expel tiny droplets, and coronavirus particles are suspended in these droplets and can then be inhaled by others, causing them to become infected. This is why it is so important for everyone to wear masks to catch these droplets and slow or prevent the spread of coronavirus. While all our lives have been affected by it, not everyone is as likely to be exposed to coronavirus or to die from the disease. And there are a number of factors that can dramatically alter people's access to care and the outcomes of that care. Here, we are going to focus on racial disparities, as those have been the most glaringly obvious throughout the course of this pandemic. While all our lives have been affected by it, not everyone is as likely to be exposed to coronavirus or to die from the disease, and there are a number of factors that can dramatically alter people's access to care and the outcomes of that care. Here, we are going to focus on racial disparities, as those have been the most glaringly obvious and well characterized as a result of this pandemic. Most studies on racial inequities focus on Black, Latino, and white populations, so those are the groups that we too will focus on in this video. But Native Americans and Asian Pacific Islanders are also deeply affected by these inequities. As you can see from this figure, Black, Latino, and Native American people are almost 3 times more likely than white people to contract coronavirus and around 5 times more likely to be hospitalized compared to white people. This might be a good time to note that when we think about coronavirus statistics, it is important to keep in mind the distinction between cases and deaths, as well as cases or deaths as a proportion of population and deaths as a proportion of cases. To show you what I mean, let's look at a figure on death rates, which shows an even more exaggerated disparity than for infection rates. It might get a little confusing, but stick with me. This graph shows the ratio of COVID-19 deaths of Black and Latino people compared to white people, broken up into age groups. So, the bars for white people in every age group is set to 1 because we are looking at the proportion of Black and Latino people who have died compared to white people in the same age group. What this graph tells us is that among people aged 35 to 44 years old, Black people are 10 times more likely than white people, and Latino people are 8 times more likely than white people to die from COVID-19. The bars get smaller for older populations, even though we know death rates are higher for older people because, again, this graph is showing ratios, not total numbers. Why do you think that the ratio of Black and Latino people who have died from COVID-19 compared to white people gets smaller the older the population gets? I'll let you think on it for a second. Here's what I think. Since all older people are at greater risk of succumbing to COVID-19, social inequities make less of a difference when everyone in that category is at high risk. But among younger age groups where the overall death risk is lower, we see the effect that social inequities have on who is being hit hardest by the COVID-19 pandemic in the United States. This is why understanding how social determinants of health affect COVID-19 outcomes is so important. So, let's break down the causes of these differing outcomes based on the social determinants of health we laid out in the first video of this series. Number 1. Biological predispositions and health behaviors. Comorbidities are chronic illnesses which can worsen another concurrent disease. Lack of access to nutritious food is associated with an increase in the two primary COVID-19 comorbidities, diabetes and hypertension. Fresh, healthy food is more expensive than packaged processed food, and in communities with less economic prosperity, which often have higher Black and Latino populations, packaged processed foods often make up a large portion of people's diets. However, comorbidities such as diabetes and hypertension mainly affect the older population, which is a large part of why people in this age group are at greater risk of dying due to COVID-19. This study of 500,000 hospitalized patients in the Bronx found that when you control for comorbidities, Black people are still significantly more likely to die after being hospitalized for COVID-19 than white people. So, let's look at the other social determinants of health to better understand why we are observing these disparities among the younger Black and Latino populations. Number 2, access to and quality of healthcare. In our first video in this series on health disparities, we talked a lot about the discrimination that Black, Indigenous, and people of color experience in the healthcare system, which makes it less likely that they will seek out care. Minorities experiencing discrimination in the healthcare system, and thus poorer care, may contribute to the COVID-19 death disparity in the US, and may make it less likely that others will seek out care if they're experiencing severe COVID-19 symptoms, which compounds the issue. However, this is not the only reason why people might delay seeking care. People of color are more likely to be uninsured in the United States because of the high cost of healthcare here, and may delay seeing a doctor because of the associated cost. Other factors which also make people of color less likely to seek out medical help include cultural and language barriers, lack of childcare or ability to take off work because of socioeconomic factors, as well as many in this group often living in less affluent communities, which are often farther away from high-quality medical facilities than white, affluent neighborhoods. It's difficult to quantify the effects that all this has on COVID-19 mortality, but it is something that public health experts have been more vocal about because of the wide disparity that has become so apparent during this pandemic. Number 3. Geographical and environmental factors. In addition to being more geographically distanced from quality healthcare facilities, people who live in lower income communities, which often have higher Black and Latino populations, are more likely to rely on public transportation and to live in multi-generational homes that tend to be more cramped. This greatly reduces people's ability to social distance and exposes older people in the home to greater risk of infection. Additionally, a potential COVID-19 comorbidity that could be caused by environmental factors is asthma, which disproportionately affects Black and Latino populations due in part to poor air quality and lower income communities, among other factors like lack of access to proper care, which we previously discussed. A study that is currently in preprint, which means it has not yet been peer-reviewed, which correlated county air quality data and COVID-19 mortality rates, found that an increase of 1 microgram of fine particulate matter per cubic meter of air was associated with an 8% increase in COVID-19 death rate. Number 4, socioeconomic inequities. You may have noticed that we mentioned socioeconomic factors in most of the other social determinants of health that we discussed. That's because socioeconomic factors affect many facets of people's lives and health. Here's another example of how socioeconomic inequities directly increase Black and Latino people's exposure to COVID-19. As a proportion of their population, Black and Latino people are more likely to be frontline workers or employed in service or production jobs which cannot be done from home. This, of course, limits these workers' ability to social distance and puts them at greater risk of coronavirus infection. It is also worth noting that women of color make up an even more disproportionate share of this labor force and bear intersecting burdens of caring and providing for their families. A Center for American Progress analysis of 2018 data from the Current Population Survey found that 67.5% of Black mothers and 41.4% of Latina mothers were the primary or sole breadwinners for their families, compared with 37% of white mothers. Regardless of race or ethnicity, having less money results directly in a decreased ability to social distance because these people have to show up for work or risk losing their jobs and their ability to provide for their families. However, we've also mentioned multiple times that poorer communities often have higher Black and Latino populations, and as we discussed in the first module of this series, this is due to systemic racism, which has made it so hard for people of color to move up the socioeconomic ladder. This helps us to understand why, as a proportion of population, Black and Latino people make up a disproportionate share of COVID-19 cases and deaths due to the social determinants of health, which affect all our lives.